Welcome to the office.
What's up, dude? Happy Saturday! It's casual Saturday today. Alright. So it's our final visit on this trip?
Yes.
Okay. Shoulder, back, breathing, life.
So I noticed like when I was sleeping, like when I go like this, like I noticed a little bit of pain right here.
Okay, in between the shoulder blades?
Yeah.
Around T5, T6?
Yeah.
That was last night?
Yeah.
And that's different?
Yeah, that's different.
That's something new.
Yeah. I don't know if it's like soreness or what it is. It's not like a lot of pain, but just like when I pull my shoulder back, I just feel it.
Okay, we'll take a look at it. How's everything else doing?
Pretty good. Yeah, pretty good. Yeah.
Okay, you ready to go back to Florida?
Yeah.
Go handle your business, right?
Yeah.
Alright. Let's see where we're at, Abed.
There you go.
And let's continue. He originally came for his deviated septum and right shoulder, correct?
Correct.
And we found through this, if you can see here, that when we look at his foundation, we had a short leg on the right, 13 millimeters, and we have the rotated pelvis and rotated sacrum. And so as we've explained so many times on this channel, that everything we're doing here starts with the foundation, right?
Right.
Okay, let's take a look and see where we're at today.
Okay.
We may have had a little bit of a shift. And that middle area that you're talking about, Abed, is around the area that controls the digestion.
Mm-hmm.
And let's go ahead and see what we got, starting at the base. And right where he's saying it is where we're getting it. Not that we like to chase the symptoms, but today it's consistent with the patient's complaint. 10 points, left side. L5 sacrum is still good. We're going to continue on that right pelvis. Okay. And let's take a look here and see. And we found something hiding, remember, for that shoulder.
Mm-hmm.
So a tiny bit higher, T2. Neck is good. So what happened on one of our visits is this. We found something here, but we also found something here. And we ended up adjusting up top and down low. The mid-back cleared up and that one showed up, you remember?
Mm-hmm.
Today they're both there, so we're probably going to need to work on both of them. Let's go ahead and check your pelvis, feet together. And this is general motion of the SI joints, guys. Feet together, open and close the knees. Right side only, please.
Okay.
Now, this is general motion, so some people had asked, is this in the Gonstead protocol? And I learned this actually from my mentor as a general motion to check for fixation. So when he does the right, the left is decent. There's a little bit of fixation there, but not too bad. Do the left side only. When he does the left, the whole right is shifting because of the fixation. Then what we do in the Gonstead analysis, go ahead and stop, please. The way we're doing it is first it's static palpation. So we're checking the top of the joint, the middle of the joint, and the bottom of the joint. If it's stuck down PI, posterior inferior, then the swelling, irritation, and edema is going to be on the top of the SI joint. If it's gone AS, it's going to be on the bottom of the joint. If it's gone IN, it'll be on the front of the joint. If it's gone EX, it'll be the entire joint. So I kind of put them both together. And that first one gives me the general. So is it left or right? It's right. Then I'll go to and say, okay, is it top, middle, or bottom of the joint? Then we confirm it on the x-ray. Make a sense? Now, in his scenario, you can see, turn it a little bit. You can actually see the glute from the top here. This is part of my visual. I can see this side is flatter, this side comes out more. And that's because this is the IN ilium, this is the EX ilium. And if one goes in, the other one goes out. They work in opposite. They don't usually subluxate together. And there are exceptions. 20 years in practice, I've had two, I think maybe 3 cases. 2 cases for sure. It's usually one or the other. One gets stuck, the other one compensates. How's this feeling today? Come back slowly towards me. That's 5. Tight.
Yeah.
Let's go to that right side. 1, 2, 3, 4, 5, 6, 7. More tender at 7.
Yeah.
7. Someone had a little bit extra sugar last night. Sit back and me, sir. So right pelvis, T7. And let's look up top here. We started on the T3. T3 seems to be good. We're going to go up to T2 now. 7, 1, right there. Yes?
Yeah.
2, 7, right pelvis. Let's go ahead and take care of 2 and 7 first. Let's go face down over here. All right, so now on the T2 side slip, it is a PLS left side slip. So for a PLS left side slip, we're going to start on the transverse process of the right side. Relax the shoulders all the way down. Bring your hands out, palms up. Little salat there for you, brother. All right. 1, 7, 1, 2. Now, there we go. We need to come around over and bring it that way. Drop the shoulders. That's a piece. Now let's come over here. There you go. Did I get your chin at all?
No.
Okay. Home run, baby. Nice. We'll do a little more of that 2 in the chair now. Awesome.
That's refreshing.
Refreshing?
Yeah.
Feet straight out, please. T2. It's a little bit. T2. That's it. Stand up, let's walk that off, sir. And for the ilium, we're going to go left side down. We're doing the IN. It's a PI1, IN 11. So we're going to do it as the IN major. We're doing it as a pull move. Let's relax there. Relax the hands. There you go. Bring this forward. IN major. 3 fingers on the medial border of the PSIS right there. I'm slightly inferior. Going to lift up a tiny bit and set through the joint. Let's bring this up. Let's get a nice good stabilization there. There it is. All right. Nice. Come up slowly, please. Let's walk it up. Like butter. Have a seat. Let's continue. When's your flight?
1:30, I believe.
No, you got it. No worries. Starting at the base. Head down, please. T2 is clear. 7 is clear. You have a little bit of heat, which I'll give you an ice pack for that mid-back. Let's get a little bit of that sacrum, dude. let's go right side down. Let's get a little bit of right side down, please. We set the ilium, sacrum came out just a tiny bit on that left side. Bottom leg straight, sacrum as a PL. Now here's what's cool, guys. The difference between an IN ilium is right there and a rotated sacrum is there. The difference is that much. Okay, that's the ilium adjustment. That's the sacrum adjustment. Stabilization is also a little different. Let it roll. Gotcha. Nice. Habibi.
Yeah, Habibi.
Look it out, Habibi. Okay, have a seat. Let's continue.
Okay.
Cool. Let's see what happened here. There you go. All clear, brother. Now let's get on to this ears.
Oh.
Right shoulder. Drop it down. There you go. Drop. There you go. Now, I am going to check your jaw today, okay?
Alright.
And part of the reason that I'm checking it is related to the breathing mechanism. And how does the TMJ affect breath? Let's see if you guys can figure that out neurologically. Open, and it's that right side. Slowly close. Let's use the condyle block today. We're going to put the condyle block to stabilize cervical spine. We're going to do the right TMJ. Open all the way, sir. Open. Slowly start to close. There it is. Yeah, Habibi. Got you, Baba. That's it, brother. You cracked my jaw. My breath is better. Open slow. Nice. Close. Bueno.
Okay.
All right. All the way back. Good. I'll be giving you some homework on an email, okay?
Alright.
Got it. That's all clear. Last thing, let's go on your back on the gray table, please.
Okay.
Any change in the breath today?
Yeah, I was breathing a little bit better in the morning, especially.
Cool. The steaming is going to be most important.
Yeah.
Every day, please, okay? Right side. Septum, nasal bone, septum. Setting, right to left. Chin down. There you go.
Yeah, I felt it crack that time.
It did crack a little, yeah. Walk off that nose job. One last time, and then we'll do the buff on the shoulder for you. Very good. You get any allergy issues down south?
A little bit.
More, what season?
Usually like the beginning of summer, like end of spring.
Okay.
I had some allergies last night too. But I don't know.
Stuff, what does that mean to you?
Like I was just sneezing a lot.
All set, brother. Finish up with the hands and check. Squeeze. Hands are good. Questions? Okay. I'll see you hopefully in about 3 months.
Yeah, yeah.
Make it out 3 or 4 months.
Yeah,
Inshallah.
yeah, sure.
And just give us a heads up. Try to give me a few days that.
Okay.
It's not about so many visits. It's about the spacing. So if you're here for the week, it's better.
Okay, okay.
If you can stay for the week.
Right.
It doesn't mean I'll see you every day.
Yeah.
But we have that week to work.
Right.
All right, brother.
Sounds good.
Safar salamat.
Yes. Thank you.
Be well.
Thank you, brother.
All right.